going to be testing the pupillary response to accommodation, constriction, and dilation. So I'm going to have you look at my pen light right here. I see that the pupils are dilating, so that's great. I see now that as I bring it closer, they're constricting. As I bring it closer, I see that the pupils are accommodating, so that's great as well. And now I'm going to be moving down to the nose. So I'm going to be palpating your nose really quickly. Do you feel any pain or tenderness? That's great. So upon palpation, the patient reports no evidence of pain or tenderness, as well as I feel no evidence of misalignment. And now I'm going to be looking at your nasal cavity. So if you could hyperextend your head for me. I'm looking into the patient's nasal cavities, and I see there's no evidence of any nasal obstructions such as bleeding or excessive drainage or septum perforation, as well as no nasal polyps as well. And now I'm going to be assessing the patient's lips, and I see that they're pink in color as well as moist. That's great. And now I'm going to be testing for patient's cranial nerve 10. So if you can open your mouth for me and say ah, I'm going to be using my tongue depressor and pressing on your tongue. So say ah. I'm looking, I see that the tonsils are intact, as well as cranial nerve 10 is intact, as I saw the uvula retract as well. And now I'm disposing of my tongue depressor after use, so that's great. And now I'm going to be assessing for cranial nerve 11. So if you can shrug your shoulders for me, that's great. And then shrug your shoulders against resistance. Great. And then shrug, turn your head this way. And again against this way. Great. And I see that the patient's cranial nerve 11 is intact, as they were able to perform these tasks against resistance. And now I'm going to be checking range of motion of your neck. So if you can look up towards the ceiling and down and laterally, left to right, and then rotate all the way. And that's great. I see that they have full range of motion in their neck. And then I'm also going to be going back and doing range of motion of your tongue. So if you could stick your tongue out for me and stick it up and down, left to right. That's great. And I see that the patient has full range of motion in their tongue. So we could proceed with the head to toe assessment. And now I'm going to be looking at the patient's upper extremity. So if I could see your hands, please. I'm looking at the patient's hands. I see that they're even in skin tone with the rest of the body. I see that they're warm to touch. I see that the patient's nail beds are free of ridges, as well as there's no, they're pink in color. Now I'm going to be testing the patient's capillary refill, so I'm pressing it down for 5 to 10 seconds. Upon release, I see that capillary refill is less than 3 seconds, which is normal and expected. And now I'm going to be performing the skin Tigger test. So I'm pinching the skin, and when I let go, I see that the skin is elastic, and the skin goes back to its original place, and so I see that the patient has no evidence of dehydration, and I see that there's no blanching of the nails as well. And then can you make this M shape for me? I see that the patient has no evidence of clubbing in the nails, which is great as well. And now I'm going to check the pulse. So I'm checking the radial pulse. I'm seeing that the radial pulse is symmetric and even, it's expected, and it's strong, as well as it's about 80 beats per minute. Now I'm checking the patient's respirations. And so I'm seeing that the chest is rising and falling, which is expected, as well as the breaths per minute is 16, which is good and normal and expected. And now I'm going to be assessing your posterior thorax. So if you could turn around on the table for me, please. So I'm assessing the patient's posterior thorax. I'm seeing that the skin tone is even with the rest of the body. I see no use of accessory muscles, as well as no evidence of barrel chest breathing. And now I'm going to be auscultating the patient's posterior thorax as well. And so I'm going to be starting at the apex. Take a deep breath for me. That's great. And another one at the second intercostal. And again. And that's great. And at the fourth. That's great. And another. And another. Deep breath. One more time. And then if you could reach forward towards your knees, I'm going to also be auscultating the patient laterally as well at the 8th and 9th intercostal space. So take a deep breath. That's great. And again. That's great. And one more time. And one more time. And that's great to hear. I see that patient shows no evidence of adventitious sounds such as wheezing or crackling. I hear that the expected sounds were normal, as well as I heard the appropriate bronchial sounds, bronchial vesicular sounds, as well as the vesicular sounds as well. So if you could turn around for me, now I'm going to be assessing your anterior thorax. So I see that the chest is, the anterior thorax is even in skin tone. I see that there's no evidence of using of the accessory muscles upon breathing, as well as no barrel chest movement. And I see that the costal vertebral angle is about at 90, so that's great. And now I'm also going to be palpating the PMI really quick. So I'm using the mid-clavicular line as a guide, as well as the 5th intercostal space, and I'm going to be using light palpation. Do you feel any pain or tenderness? That's great. And I feel no pulsations as well, which is expected and normal. Now I'm going to be auscultating the patient's anterior thorax. So, take a deep breath. One. And another at the 2nd intercostal space. At the 3rd intercostal space. And again at the 4th intercostal space. And again at the 5th intercostal space. And that's great. And I hear no evidence of adventitious sounds such as wheezing or crackling. And now I'm going to be doing it again, but now with the bell of my stethoscope. So again at the 2nd intercostal space. And again. And again. And one more time. And that's great. So I heard S1 and S2. As expected, I heard no evidence of S3 and S4. I heard no murmurs or gallops. S2 was louder than S1, which is to be expected and normal as well. And now I'm going to be going back and assessing your ears. And so I'm going to be looking at the patient's ears. If you could move your hair. So I see that there's no redness or irritation. Now I'm going to be palpating the ears. No tenderness or pain when I palpate the auricle. There's no pain or tenderness when I palpate the auricle. That's great to hear. So patient reports no pain or tenderness when I palpate the auricle. Now I'm going to be looking at the ear as well, and I'm going to be seeing that there's no redness or irritation, there's no excessive debris or cerumen, and so I'm going, because it's an adult patient, I'm pulling up and back at the ear, and I'm bringing my otoscope really in, and I'm seeing that the tympanic membrane is pearly gray, and the cone of light is at about 7 o'clock on the right ear, and that's great. And now I'm going to have you start over there. And I'm going to have you walk towards me. I see that the patient's gait is normal. They were able to maintain balance. I see that there's no hesitancy when walking as well, which is great. And now I'm going to have them, and they had their opposing arms were swaying when walking as well. And they were able to maintain balance. And I'm going to have you walk that way, please. Heel to toe. And that's great. I see that the patient was able to maintain balance as well. And then if you could stand here for me. You could face me. I'm going to have you take your opposing foot, and I'm going to have you do this. Rub it against your shin. That's great. And again. And that's great to see. And then I'm going to have you perform the Romberg test. So if you can stay on one foot and then hop, their eyes closed as well. That's great. And they were able to maintain balance, so they were able to perform the Romberg test well. And now I'm going to check the rotation of your spine. So if you can hyperextend like this, and then lower to the ground. Okay, And if you could turn around so I could look at your back. Can you do that one more time? And look up. Okay, and then can you rotate laterally like this? And again. That's great. And then rotate. Okay, great. And I see that they're able to perform full range of motion in their back. And then I'm going to also have you take a seat back on. And I'm going to be moving back into the fine motor skills of the upper extremities. So if you can do rapid alternating motions like this. Okay, great. Take your index finger and touch my finger. That's great. And then do this with your hands and do this like, okay, that's great. I see they're able to perform these tasks so their fine motor skills are intact. And now I'm going to also be testing for the patient's strength. So can you push against my hand? That's great. Can you pull against my hand? Pull my finger. Okay, great. And I see they have 5 out of 5 strength. And so that's great. And now I'm also going to be performing the whisper test. So I'm going to pick a 2-syllable word and you'll repeat it back to me. Ready? On the right ear. Pop-Tart. They were able to repeat Pop-Tart back to me. And now the right ear.
All right, so are you okay with starting with your vitals today?
Mm-hmm.
All right, so I'm going to take your blood pressure, your heart rate, your respirations, your temperature, and your SpO2 level. Okay, so I'm going to go ahead and put this on your finger. It's just going to hang out for a little bit. Okay, and we're going to get your blood pressure. All right, so I'll flip this over. And I'll just have you hold this for a second for me. Actually, is that uncomfortable with that?
It's okay.
You're okay?
Yeah.
Okay. All right, your blood pressure is 119/78. Go ahead. I'm going to help you hold that for a second. To the side, and we'll take this off here. Okay. And I'm going to take your temperature really quick for you. 98.8, so no fever today. I'm going to go ahead and read this off. Let's see, we have 98% oxygen saturation on room air. And go ahead and I'll check your pulse right here. Just gonna move this guy out of the way. Right. Going through, so I'm just going to go ahead and I'm going to palpate the precordium over here. It's just going to be like this. And just feel free to breathe normal, whatever is comfortable for you. I'm going to do the same thing on the back here. And I'm not noticing any lifts, heaves, pulsations, or thrills to touch. I'm gonna go ahead and I'm gonna poke your skin here. See if you're okay. Your skin is warm and dry. You don't appear to be diaphoretic right now, so that's good. I'm gonna go ahead and I'm going to auscultate. All right, so I'm just gonna be moving this back and forth across your chest. So with each lift, I'm gonna have you breathe in, deep breath in, and deep breath out. Okay, here we go. All right, and you're not feeling dizzy at all?
Nope.
Okay, I'm gonna come around to the back side here. I'm just gonna move your hair out of the way, and I'm gonna do the same thing. All right, thank you. And I'm going to go ahead and check for jugular vein distension. So I'm going to be looking along the back here. Okay, not noticing any distension. All right, and I'm going to go ahead and palpate your lymph nodes here really quick. Anterior, posterior, and just above your collarbone here. All right. And then can I have you swallow really quick for me, please? Thank you. Just feeling your trachea there. All right, now I'm gonna go ahead and listen to your heart sounds. All right, so with this, you can just breathe normal, whatever's comfortable for you. I'm just gonna be doing 5 spots, and then I'm gonna do your carotid arteries. Okay, and then for your carotid arteries, I'm just gonna have you hold your breath really quick. Thank you. And then I'm gonna switch it to the bell, and I'm gonna hit those same points again. And feel free just to breathe normally, whatever's comfortable for you. Okay, and I'll have you hold your breath again here. Perfect, thank you. All right, so do you have any history in your family of cardiovascular disease?
No, I don't.
Anything? And do you have a personal history?
No, I don't.
No? Okay. And then as far as your lungs, do you have any history of lung cancer or smoking in your family?
No history of smoking or lung cancer.
No history of smoking. Okay. And do you personally smoke?
I do not.
Do not. Okay. So we can go ahead and we can move on to your skin assessment here. So I'm assessing and I'm looking, and I see that you don't have an IV, but if you did, I would be checking for erythema, swelling, and drainage. I'm visually looking over your skin, and I'm not noticing any masses, lesions, any erythema or swelling, anything to cause concern at the moment. Do you personally have any concerns about your skin though, or notice any changes?
No, I haven't noticed any changes.
Any changes? Okay, that's good. I'm gonna go ahead and I'm gonna assess your capillary refill here. Go, less than 1 second, and your skin turgor. All right, I'm seeing that you aren't dehydrated, so that's good. And I don't notice any clubbing here as well. I'm gonna go ahead. All right, so I'm gonna check your eyes here. So I'm gonna have you stare at that back wall. Okay, I'm gonna do the same thing on this side. And looking at the other eye. All right, and then if I could just have you follow the end of this. Great. All right, so I'm gonna say that your pupils are equal, round, and reactive to light. And as I'm looking at your eyes, I'm not noticing any eyelid drooping. Your inner canthus looks healthy. I'm noticing that your sclera and your conjunctiva is white. Those are all good things. I'm gonna test your hearing over here. So can you hear this?
Yeah.
Okay. And how about on this side?
Yes.
Okay, take a look. Looking for cerumen, foreign bodies, erythema, drainage, otitis, nothing there. I'm looking for the same thing on this side. Nothing to note. And then palpate your nose here. Okay, and can I take a look at your nasal mucosa? Perfect. Okay, I'm not noticing any redness or inflammation. And can I have you say "ah" for me? Look. Okay, I'm looking at your tonsils. They're there, but they're not protruding, so I'm gonna say that they're grade 1. I'm looking at your dentition, your gums, your palate, your tongue, and I'm not noticing anything out of the ordinary
for tenderness
there.
in those areas. So I'm going to have you turn that way, and I'm going to test for chest expansion. So I'm going to place my hands and have my thumbs pointed towards each other and pinch a piece of skin. I'm going to have you take a deep breath. And out. And again. Good. Now you can stay like that. I'm going to check for tactile fremitus. So I'm going to place my hands here and I'm going to have you say 99.
99, 99, 99,
Okay, again.
99, 99, 99.
Okay. And now I'm going to percuss the front. And then I'm going to do the back. I'm looking for any dullness, so I'm going to have you take a deep breath and breathe out slowly. Nope, take another deep breath and breathe out slowly. Okay, and then again, I'm going to start the scapular area. Okay, good. So I don't see any areas of dullness. And next we will move on to auscultation. So I'm going to have you breathe normal. And then put it here. Okay, now I'm going to have you say 99.
99, 99, 99, 99,
And then say E,
E, E,
artery. Okay, and I do not feel any thrills, and now I'm going to palpate the aortic area, pulmonic, and the PMI. Okay, and I don't feel any pulsations, so now I'm going to auscultate. I'm looking for any thrills.
you want me to sit out?
It's up to you. Take a deep breath and hold it. Okay, you can breathe out. And then do that again. Okay, I don't hear anything.
Next, I'm going to auscultate.
Let me sit up.
I'm going to auscultate all of the with the bell of my stethoscope, looking for any murmurs. So I'm going to do aortic, pulmonic, Herb's point, tricuspid, and mitral. And then I'm going to listen with the diaphragm. Okay. And then I'm going to have you lean forward. Okay. I'm looking for any murmurs. If I noticed any murmurs, I would know the intensity, the location, the rhythm. If I notice any splitting of S1 and S2, I'd note the timing and intensity. So now we will move on to abdomen. So I'm going to have you lay down.
Oh, you want this?
Yeah. Watch out.
Okay.
Ellie, watch out.
Ellie, move. Ellie, get.
Okay, so general appearance of her abdomen, it is rounded. I do not see any lesions, rashes, or scarring. There's a small amount of striae. Her umbilicus does not have any bulging or inflammation. I do not see any peristalsis or aortic pulsations. So next I will move on to auscultation.
Ellie.
Okay, so her bowel sounds are active. Next I'm going to listen to her arteries for any thrills. So aortic, renal, and I do not hear any thrills. So now we are going to percuss. I'm looking for any areas of, I'm looking for tympani. Ellie! I'm hitting, when I do this for the respiratory and for this, I'm middle finger. Ellie!
Ellie, no.
Okay, so now I'm gonna look for the liver. And then the spleen. Okay, so I do not hear any dullness. And now we're going to palpate. So I'm gonna palpate lightly first. Any tenderness?
No.
And then I'm gonna do deeply. Any tenderness?
No.
If I notice any masses, I would note the size, location, consistency, and mobility. Now I'm going to look for rebound tenderness by pressing down and quickly lifting. Any tenderness?
No.
Next I'll check for the liver, which is about 2 centimeters down, and the spleen, which I do not feel, and the aortic width. Okay, and now I will check for the Murphy sign for cholecystitis on the right side. Do you have any tenderness?
No.
Okay. So now I'm going to have you lift your leg, look for the Rosvik sign, press against me. Any tenderness?
No.
And any tenderness?
No.
Okay, and then I'm going to have you move your leg internally. And then do the other leg. Any tenderness?
No.
Okay. So okay. Now I'm gonna have you put your hand in the middle. I'm looking for ascites. Okay, no signs of any ascites. And now I'm gonna have you sit up.
Get to sit up.
I'm looking for any costal-vertebral tenderness. I'm going to have you look that way. Turn that way. I'm looking for any flank pain. Yes.
Okay.
Any tenderness?
No.
Okay.